We're back now with Dr. Darien with a question for the ER doctor right here. How can I tell the difference between a sore throat and strep?
A great question. It's not easy always to tell. You know, strep is increasing. We're seeing a rising rate, and it's kind of inching back toward pre-pandemic levels, especially among young kids. So number one, strep is caused by a bacteria called streptococcus. How you can tell the difference? Often how the symptoms come on. Strep throat is usually a little bit more painful, and when you look at the back of your throat, you might often see changes. For example, a white film over the back of the throat, or even red spots over the roof of your mouth. If you notice those changes, you should get tested because we want to prevent the complications, not just the infection.
But, like, is it contagious?
Strep throat technically is
That was my
contagious.
question.
I would say the risk of getting it from talking to someone is relatively very low. I would say close contacts are most likely at risk, but the most important question that parents ask is, when can my child go back to school?
Mm-hmm.
Which I understand. Usually about 24 hours after starting the antibiotic treatment, that child is safe to go back to school, so just about a day.
Those parents are trying to get those kids back in school.
And I understand why. That is usually their main question. How long do we keep them out of school, and when do they go back?
So how do you treat it? I mean, is it with antibiotics or?
Most commonly antibiotics. If you want to understand exactly what the percentage breakdown is, for adults about 15% of our sore throats are due to strep. The rest are due to other types of viruses. For kids, however, it's up to about 35%. So we're a little bit more mindful, a little bit more proactive, again, to not just treat the infection, but prevent the complications.
What about sore throat, though? Is that something that they really need to stay home for?
I don't think so. If the sore throat is manageable, if they're still tolerating liquids and foods, then you can send that child to school. But if that sore throat is accompanied by other symptoms, like a headache, a fever, those are signs that it might be systemic, might be contagious, and that's when you have to be more cautious.
Adults just get a hot toddy.
Exactly. Yeah.